Figuring out how do they calculate, like what's the due date calculation process?
Let's discuss how we're going to figure out your estimated due date. There are two parts when it comes to estimating your due date: your last menstrual period and an ultrasound. The first step is using your period, and there are two important things that we need to know about your period. How sure are you of that first day of your last menstrual period, and are your periods reliable? So what we mean by sure is meaning that you know exactly the first day of your last period. What we mean by reliable is that your periods really should be coming every 28 days, because that's what this calculator is using, is a reliable every 28-day cycle. So if you're breastfeeding and your cycles are not every 28 days, if you have PCOS and your cycles are like every 45 days, then your period is no longer as reliable and we can't use this kind of calculation. The next step in determining your estimated due date is an ultrasound. The ideal time to get an ultrasound is in the first trimester. Everything after that, there's a little bit more variability in the size of that fetus. This is a chart we use to compare your last menstrual period with your ultrasound. So if you are sure of your first day of your last period and your periods are reliable, we use this chart to determine if you had your ultrasound in the first trimester and those dates are within 5 days, then we say your last menstrual period equals your ultrasound. If your dates in your ultrasound are off by a certain amount of days, then we go by the ultrasound finding. We also go by the ultrasound finding if you're not sure of your last period or your periods weren't reliable. We'll use the ultrasound estimated due date. And most importantly, we do not change your due date once we've used this method. Once your ultrasound and your period have all been established and someone tells you what your due date is, they should not change your due date later on in your pregnancy.